Same for Chris Brown.
Sorry, I'm trying to get to all of you here.
I've got it now, thank you.
Okay, anybody else I'm missing before we get started? Okay, Dr. Neville.
Thank you. Good afternoon, everyone. I am here to give a few prepared remarks about the COVID cluster that we've experienced at PeaceHealth Southwest. And then, as Deborah mentioned, I'll take some questions. I want to start by contextualizing where we're at in terms of COVID at PeaceHealth Southwest. So our current census as of this morning was 56 COVID patients. And of those, 8 were in our ICU. The rest were in intermediate care level or general med-surg patients. We did admit 6 new COVID-19 patients overnight. Half of those were from home and half of them were from skilled nursing facilities. Our hospital census is pretty typical for this time of the year at 273. Our ICU itself has 36 patients in general, including our COVID patients. So I'm here mainly to talk about the COVID cluster that we experienced. This was found on one of our general medical surgical units. And I want to start by saying all the patients have been cleared and moved from that unit. And the unit has been closed since the 1st of January for deep cleaning and disinfection of all the surfaces. The cluster of patients who totaled 19 in total were admitted with negative COVID tests, and then they subsequently were found to be COVID positive during their hospitalization. We also detected that 11 healthcare workers were involved in this cluster. I'm pleased to say we have had no new identified cases since the 2nd of January, and no identified cases that resulted in a healthcare worker being exposed since the 28th of December. At the end, I may speak a little bit about some of the other numbers that have gotten out in the press about the total number of patients affected, but it is 19, and just making that overt today. So going over the timeline a little bit, we first became aware of a patient being potentially infected on the 27th of December. We believe, in looking at this patient's case very carefully, that the patient was likely infected in the community, came into the hospital, and manifested COVID only after hospitalization. 2 patients, asymptomatic patients, were identified the next day on the same unit. And again, these were asymptomatic patients, but that led to a series of rapid steps as we tried to respond to that. So one of the things we did is test all the patients on that unit and put all the patients on that unit in isolation precautions. By the 29th, we had closed that unit to any new patients. And then we tested out of an abundance of caution, excuse me one moment. We tested all the patients in the hospital just to make sure that the issue was indeed isolated to this one unit, and it was. So the actions that we've taken thus far, we began working with public health almost as soon as this was identified on the 29th of December. As I mentioned, we closed the unit to new admissions starting on the 29th, and the unit remains closed while we do very deep disinfection and making sure that it's very safe to reopen. We also tested all the caregivers who work on that unit going back 2 incubation periods for the virus. And again, really out of an abundance of caution, just making sure the extent of the cluster, and that did reveal ultimately the caregiver exposures that I mentioned before. We have taken a number of other steps going forward. So when the unit is reopened, We will be doing, besides our typical disinfection of every room very deeply after a patient is discharged, we'll be adding UV lights disinfection to those rooms. The staff who work in that unit will be added to our surveillance monitoring program. And what that means is they will have the opportunity to be COVID tested at least once a week as they choose to. We also take a number of actions to the general medical community. One is reminding healthcare workers about PPE diligence and use, and making sure that they're absolutely impeccable in use of protective equipment. We also are reminding patients who are in a room to wear a mask when someone else is present in the room, unless it interferes with breathing or something like that. We did reduce the number of surgeries that we were performing in order to be able to redistribute staff. And on that note, we did ask potentially exposed healthcare workers to self-quarantine. Initially, that number was 86. It is, as we've cleared healthcare workers, that's reduced to 59 as of today. And we continue to work with them to make sure that they're safe. We also have evaluated the air exchanges in those units and making sure that the filters are up to date, et cetera, and all that is coming back reassuring to date. So I want to emphasize a couple things. One is that the investigation for the underlying cause continues. It remains unknown, so really have many teams working on figuring out what exactly happened, but at this point it is unknown. We, as of today, sent out the viral samples from the folks affected for genomic testing to make sure that we're not dealing with a COVID variant. Just a reminder, though, even if we do find a COVID variant, which is being found throughout the United States, the advice and the guidance would really be the same, and that is masking, distancing, and hand washing. The other big thing that I want to emphasize is that the community prevalence of COVID matters a lot. So as of this morning, Clark County was a high prevalence county in terms of COVID in the community. And that really impacts every one of us in terms of our families and even our hospitals. So PeaceHealth Southwest has treated successfully about 500 COVID patients since the start of the pandemic and released them back into the community safely. We are a Leapfrog grade A hospital, so a very safe hospital. And all of our patients upon admission, and if they undergo a procedure or a surgery, get COVID testing again. We also ask our caregivers to get symptom checked and temperature checked upon admission to the facility each and every day. All our healthcare workers, of course, are using protective masks, protective eyewear, and then additional PPE for any concerning patients or procedures. The fact that this cluster could happen at PeaceHealth Southwest, a very, very safe hospital, really shows that this is a highly prevalent virus in our community. And the fact that it did occur here, unfortunately, means that the chances of it entering our homes, our places of work, and other hospitals is unfortunately higher. We are very optimistic about the ongoing vaccinations. We have vaccinated about half of our staff to date, and are continuing that with daily vaccine clinics. One of the things that I wanted to mention is I did say at the beginning that we identified 19 patients that were associated with this particular cluster and 11 healthcare workers. We had earlier released a number of 30 patients, and I'm here to say that was a mistake. 19 patients were associated with this particular cluster. As part of what we did test every single patient in the hospital again, so for a second time. And as might be expected, some of those patients did come back positive for COVID, which again is to be expected. So why is that expected? Well, number one, once you've had COVID, you can test positive for COVID for up to 90 days thereafter and not be infectious. So you can continue to shed the virus and test positive. So some of the cases we think that we identified were related to that. It's also the case that sometimes you can come into the hospital, we test everybody, you can test negative on admission, and then if you're incubating the virus already, but it's not showing up on the test yet, it can test positive later. So far, we have not found, of the additional patients we found in the hospital when we tested house-wide, we haven't found any of those linking back to this particular cluster, and so far all have been very explainable by the mechanisms that I talked about. So I want to stop there and feel free to ask any questions.
Tim Gordon, do you have a question?
Yeah, I do. Thanks very much. Hi, Dr. Neville. How are you?
Hi, Tim.
Hi. Hey, I'm a little, maybe I'm misunderstanding, but you say that you're not sure of the initial origin of this, but you mentioned that you believe the first initial patient came in not testing positive, but his was incubating and manifested. How do those two go together? Do you think that's what happened, but you're not sure yet, or?
Oh, thank you for asking that. So again, everyone gets tested on admission, and then you're negative unless and until you show symptoms that would suggest that you in fact do have the virus subsequently. So the index patient does look like he or she was exposed in the community, came in, tested negative because he was in that window, and then tested positive later. So in terms of the actual start, we do know that. What's a little bit unknown at present is how it spread from that one patient being affected to the other 18 patients. And that's what the team is really zeroing in on, because to date we have not found any breaches in our PPE protocol. All the docs and nurses taking care of that particular patient really used impeccable technique, and we're very safe. And so what we're trying to figure out is how it spread from that individual.
Wonderful. And if I could just ask a quick follow-up as well, it's related. I'm wondering what percentage of participation, I guess is the way to put it, you're getting from your employees in terms of getting vaccinated. What's the percentage of employees who are actually getting vaccinated?
So far, we have had half of them be vaccinated. We do not mandate vaccination, so it's a voluntary thing that someone can decline to do. And so far, the numbers who've come forward and said, I decline to do this, are very low, probably less than 5%. And we continue to try to educate about the safety of the vaccine and the importance of the vaccine.
Thank you very much.
Chris Brown, you have a question?
Yeah, Dr. Neville, two real quick questions. The first being, can you talk a little bit about the impact of this on staffing levels in terms of how you're handling the caseloads and other things? And then secondly, do we know if any of the healthcare workers who were infected had received their first dose of the vaccine? I've had a couple of people wonder about that.
Thank you. So starting with the second question first, most of those healthcare workers who did come down with COVID-19 had not received the vaccine as of yet. As you know, even the first dose does give about a 50 to 52% resistance to acquiring the virus. So we're optimistic that as more and more folks get vaccinated, we'll be in better shape in terms of resisting clusters occurring in the future. In terms of the staffing, I started very deliberately by mentioning the number of COVID patients already in the house, which is an all-time high for us. This is a time of staffing crunch for us. We did unilaterally and freely decide to stop some of our surgical procedures to redeploy staff to help with that. We also are allowing and encouraging some of our staff who are completely asymptomatic to return to work if they remain asymptomatic, they use PPE and they get a COVID test daily as they start their shift. So we've added those elements in to keep them and keep our patients very safe as we look to maintain adequate staffing.
A real quick follow-up on the vaccinations. I know we're closing in on the date that people who had their first shot of the Pfizer vaccine should be getting their second doses. Can you talk at all about the schedule for that and where you guys stand in terms of supply? Do you have adequate supply to start doing those second doses in addition to continuing to do first doses for people?
Thank you. We do have adequate supply, and in fact, today marks the day when we are starting our second dose administration for those eligible for that. And we do have a vaccine clinic running almost every day with the exception of Wednesday this week, including Saturday, to get folks vaccinated. And a lot of folks are coming back for their second vaccination. At the same time, we're still trying to get the other half of our caregivers their first dose of vaccine.
Kelly Azur.
Hi, thank you for taking the question. It is backtracking a little bit to a question earlier about any of the health workers who have tested positive now for COVID-19. The ones who may have had that first dose of the vaccine, I know you say it's very few of them, but for the ones who have maybe had that first dose, does this affect them getting their second dose at all, or is it just kind of an unfortunate event that happened in between?
Oh, thank you. It doesn't affect them getting their second dose. So we still recommend vaccination at this point, even if you have had COVID.
And then a follow-up question to another question earlier as well. How does this change protocols going forward for you guys, or does it change anything having this happen?
That's a great question. So we've looked very carefully at all our protocols. We have not, as of yet, found the underlying cause of why this happened. And if we do in the future, of course, we would respond to that very, very quickly and change any protocol lapses that we would find. At this point, it's really emphasizing again what we know to be true, which is, impeccable, very strict PPE use, not letting down one's guard at all. And then, as I mentioned, we have put in some extra safety measures to keep our patients and caregivers safe, including adding UV light disinfection to rooms as patients are discharged from this particular unit. The ability of our caregivers to get COVID tested sort of on an elective basis, so as they see fit as part of our ongoing COVID surveillance program. But at this point, we have not found something that would indicate a need for broader protocol changes. And like I said, while it's still too early to say definitively, at this point, we haven't seen any further cases break out.
And last question I just got from a viewer is they're now questioning the efficacy of wearing masks, seeing as now healthcare workers have come into contact and gotten the coronavirus there at PeaceHealth. What would you say to those who are wondering if masks really work?
I would say, and one of the reasons I started by saying that we've taken care of 500 plus COVID patients and had the honor of doing that since the pandemic started, is that we have a lot of experience doing this. And our doctors and nurses and pharmacists are really some of the best at providing expert care for these patients. And this is an unfortunate anomaly that this occurred. But our vast experience, if you put it all together, has been that masks really do make a significant difference. And one of the metaphors that I like to use related to this is that the vaccines will help. It's sort of like a fire hose that will put out a fire in the community with COVID. But if the fire is very huge, it's really going to take a long time to do it. And a lot more people will suffer and unfortunately be hospitalized and perhaps even pass away. So mask wearing is something that we take very seriously. We think the science strongly backs mask wearing. And if anything, we are doubling down and intensifying our efforts in that regard.
Thank you.
Amelia Templeton with OPB.
Yeah. Is there any indication or any evidence that this could be the more transmissible variant of COVID-19 that's been popping up in other states?
We can't rule it out at present. That's why we sent the samples for testing. We should have the results for that in about 10 to 14 days. So not impossible. And again, I want to emphasize, even if it comes back as that more transmissible, more infectious variant, it really means that the same strategies apply, which is meticulous hand washing, lots of caution about getting too close to folks physically, and then of course mask wearing.
Question about the patients. Were any of them sharing rooms, or were they all in private rooms?
A few of the patients were sharing rooms, but the vast majority were in private rooms.
And then final question, how do you know that that first index patient, you called them, how do you know that that was the first person connected to this cluster?
Yeah, it has to do with how one traces back the source of infection and looking for other possible preceding infections. So our team of what's called epidemiologists, who are sort of experts in tracing infections, look for is where did it occur? Did they have any roommates or not? Were there any healthcare workers who might have been symptomatic themselves or pre-symptomatically sick with the virus at that time? And you're sort of excluding other possibilities. And then you're looking at the time frame. So you're looking at when this patient came in, when he or she got tested, and when he or she became symptomatic leading to the second test. And if all that falls together in the right way, it forms a mosaic pattern, which really strongly suggests that that's where it started.
Andrew Thien with the Oregonian.
Hey there. When a patient is admitted, they have to be tested. If they test negative, are they required to wear masks?
If they test negative, we are asking that they wear a mask in their room, and not all the time, but when someone else enters the room with them. And that's really just an added layer of protection because we know that there is a very small risk that they could be in this in-between state, right, where they've got the virus, but they're not going to show up on the test yet. And it's a way to, again, add a layer of protection to keep our healthcare workers safe and keep other patients safe.
Do we know whether this patient was wearing a mask after initially testing negative?
This patient was, correct.
And this was just a general, admitted for surgery ward of the hospital?
Correct.
Here in the Portland side of the metro area, lots of hospitals have canceled elective surgeries. Well, first off, are these elective surgeries? Can you speak to that? And I guess why hasn't PeaceHealth taken that action until now to cancel those surgeries?
So this patient was on a med-surg floor, which, and this is where the cluster broke out. So it's people who are here for surgeries and or medical conditions, so heart attacks, strokes, things like that. So it's a mix of those types of patients. We at PeaceHealth are following our governor's proclamation regarding moving forward with surgeries or canceling surgeries. And we, since the start of the pandemic and the governor's proclamation, have restricted surgeries to those that we deem to meet the governor's proclamation and the needs of our patients. And that really involves not proceeding with any surgeries where putting it off would not harm the patient. And often we're using a 90-day window or horizon about that. So if putting off the surgery would cause harm to that patient within the next 90 days, we have been trying to go ahead with surgeries, partly because, like a lot of hospitals, we found that a lot of patients were actually harmed by putting off surgeries too long, or cardiac procedures or pacemakers, things like that. So we evaluate on a week-by-week basis through a complex algorithm which surgeries can proceed and which can't proceed. And the only change that we've made recently to that week-by-week discernment is that with this cluster occurring, we did pull back even more from surgeries, and mainly for a staffing reason, to be able to reallocate some of that excellent staff to take care of others.
All right, just one more. How are these patients doing? Do we have any patients from the cluster in the ICU?
The patients are doing quite well overall. I don't believe, as of yesterday, that there were any that required ICU level care.
Thank you.
Chris Brown has a follow-up question.
Yeah, Dr. Neville, I had heard reported one place, and I'm not sure what their source was, but I'm wondering if you can comment on it, that healthcare providers at PeaceHealth have been asked to fill out a questionnaire before receiving their dose of the vaccination, and that a number have basically been denied vaccination because concerns of potential health impacts. I wonder if you can respond and talk a little bit about what requirements you're giving for healthcare providers before they can be vaccinated. And then on that, have you had any, or can you comment on whether you've had any so far that have had any adverse reactions similar to what we've seen other places?
Thank you. So let me start with the second part about adverse reactions. We've had a lot of people with sore arms after being vaccinated. We, across the PeaceHealth system, so we're a system of hospitals in Alaska, Washington, and Oregon, have about 16,000 healthcare givers in total. We've had a total of 3 events related to vaccines. 2 of the 3 were very minor. One of the 3 was a more significant event that did require some more intensive medical intervention. But if you think that we've vaccinated about 10,000 or so, a little bit less than 10,000 of our healthcare workers so far, and to have one event, it's pretty minor in the scheme of things. Obviously, our sympathies to the one healthcare worker who was affected. In terms of what we require folks to attest to, we do what's called an informed consent discussion with our healthcare workers as they get the vaccine. And that's really what's mandated by the FDA. We're not adding anything in addition to that. So it's things like you haven't received certain kinds of other vaccines within the 4 weeks preceding. If you're pregnant, that you've discussed the risks and benefits of going ahead with the vaccine with your regular doctor or your OB doctor. It's elements like that that are very standard. Have you had Guillain-Barré or other serious vaccination reactions in the past? We do monitor all our folks getting the vaccine for 15 minutes after the vaccine. And then if you have any history to suggest a more significant reaction, and we deem it still safe to go ahead with the vaccination, we do monitor folks for a full 30 minutes.
Okay, do you know how many of your healthcare workers have been disqualified from getting the vaccination due to that questionnaire? And then can you confirm whether any of the folks that have had adverse reactions were here in Clark County?
I don't know how many folks have been disqualified from getting it. If they were disqualified, it usually would be a temporary disqualification. And again, not on the basis of PeaceHealth's policies, but on the basis of what the FDA is asking related to the use of the Pfizer vaccine. And often, for example, if you are pregnant and you haven't discussed that with your doc, we'll ask that you go do that. And if your doc says fine, you come back and you get vaccinated. There are a very small number, of course, who are severely immunocompromised or have other things that would give us pause a little bit more as we read the FDA guidelines around getting the vaccine. But those are very small, but I don't have those numbers immediately available.
Okay, and then as far as the adverse reactions, can you confirm that that was somebody here in Clark County, or?
The one that resulted in more significant, actually, I don't know where in PeaceHealth that did occur.
Okay, thank you.
Thank you.
Katie Fairbanks.
Hi, yes. Related to PeaceHealth St. John, do you kind of have a more specific number about how many of the staff here has been vaccinated? Is half the whole system, or half is about for Southwest?
It is almost exactly 50% at PeaceHealth Southwest and 49% of the staff at PeaceHealth St. John.
Great. And then for folks here, in the Longview side of Clark or Cowlitz County, obviously some folks probably go down to Southwest, who may be concerned about the cluster. I don't know if any, folks may just see the PeaceHealth name and have that be our hospital here too, and may have some concerns. I don't know if you kind of have anything to say for folks just in general who, may have seen that there was a cluster, that it's still kind of okay for them to go to the hospital.
Thank you. It's not only okay, but it's strongly recommended that if you have a medical emergency that you do seek medical care. What I will say again, sort of putting the cluster that we've unfortunately experienced at PeaceHealth Southwest is in perspective. This is in the context of almost 10 months of very successful treatment of large numbers of COVID patients without any significant clusters or outbreaks whatsoever. And the same is true for PeaceHealth St. John. So we use the same rigorous CDC-approved infection control measures. We share practices back and forth between our expert physicians in infectious diseases and our intensivist physicians. So it really is a network approach. We have not had any clusters whatsoever at PeaceHealth St. John, and certainly recommended as a very safe, effective place to get care. One of the things that we noticed earlier in the pandemic nationwide as physicians is that folks were worried about getting care in hospitals and put off getting care. And unfortunately, there were a lot of folks who presented to the hospital too late to really help them as much as we could have earlier. So a good example is someone has a heart attack and they wait a week or so to come in, and by the time they come in, we can't work with the heart muscle in the way that we could have earlier, and they're much more impaired for life, or they've had a stroke, and in the first couple hours after a stroke, we can do amazing things to restore function, but we can't do that 2 or 3 days later. So strong recommendation: please keep coming to the hospital. PeaceHealth Southwest and PeaceHealth St. John are extremely safe hospitals. Our safety ratings really demonstrate that, as well as our long-term experience treating these patients very safely.
I'll take one final question from Tim Gordon.
Thank you. I appreciate it. Hey, Dr. Neville, to kind of put this in context, I mean, I'm having trouble getting Washington State to give me the specifics, but in Oregon, the health authorities, has a specific list of hospitals with outbreaks, and there's more than a dozen on the list. Providence, Portland has a really sizable one, 29 people. This is the most current one. So I guess the question is, where does PeaceHealth Southwest Washington Medical Center fit into the bigger picture of hospitals and dealing with this and dealing with outbreaks?
Thank you, Tim. Unfortunately, a lot of hospitals, to your point, across the country have had outbreaks or clusters of COVID in their hospitals. And I think at PeaceHealth Southwest, we really pride ourselves on being the best and doing the most exceptional jobs possible for our patients. So we're disappointed that this occurred. We're in good company. Some of the best hospital systems in the country have had clusters occur, and our commitment is to learn from this event and really to make sure that it never happens again.
Thanks again.
Well, thank you. It looks like that's all the questions. So we appreciate all of you spending time with us today. And if you did not get the audio, we can send that to you afterwards. And if you have any follow-up questions, you can follow up with us as well. So thank you all.
Thanks, everybody.